time.
Dr. Fordyce, you got some swelling in your incision there?
Yes, and a lump came, and then his pulse was coming out, and it was excruciating pain all of it.
So right here, a little bit of swelling.
Yes, sir, and it was like in pulse, and it just,
where
pain just like, the pain shoot, like,
where was pus coming out?
my husband looked, and he said...
Out of the drain hole, or?
He didn't say out of the drain hole, he just said it was pulse, he had like a little Q-tip too.
Okay, is it seem any better now? Meaning did lots of stuff drain out?
It's a lot of drain from over this side, it did, yes sir.
No, what about back there?
No sir, it's like that.
Meaning it's the same?
No, it's the worst one, because the lump, it wasn't back there.
Okay, meaning like you went to the ER, you feel like it's worse since Saturday?
No sir, not worse than sir.
I see there's a little...
Oh God, help! Whoa, God, it hurts.
So we're all in there?
Yes, sir.
Okay. Well, it certainly doesn't look infected to me. I do see that there's some swelling back here that I don't expect. I don't see anything there. Oh, and all this stuff, I mean, that's, the post-operative surgical area, it hurts, no surprise.
Yes, sir.
And I didn't, touch that when you were in the clinic the other day because there was no real reason to. I agree, there's a little swelling here. You may have a little fluid collection.
Yes, sir.
But I don't think I would do anything about the fluid collection. The only thing that could be done, and I'm not convinced I should, would be put a needle in there and drain that. But I don't think that's going to be a magical, solution to the discomfort you're having.
Yes, sir.
I mean, I don't think it's infected. No, I think they may have given you an antibiotic.
Yes, sir.
That's not the end of the world.
Okay.
And I can't get any. Talking about pus, I can't get any pus to come out of here. I'm just pressing.
Yes, sir.
And I'm sorry.
Okay.
So I think it's going to be okay. I think you have a little bit of fluid in the when we take the drain out, it doesn't magically make the drainage go to zero.
Yes, sir.
We take the drain out after 4 to 5 days, and that's usually, well, as a rule, that is long enough.
Yes, sir.
And it's a little swollen there,
yes, sir.
right there,
Mm-hmm.
and it's tender all over. I'm not going to touch it anymore.
Yes,
but I'm just mashing on it a little bit to see if I can get anything to come out of here. This is a little bit of crust, a little bit of blood from the day of surgery. That sort of thing you just want to leave alone on here because that's got glue on there. That's why it looks the way it does. There's glue on the incision.
Okay.
And you just leave that alone for a total of 3 weeks.
Yes.
Now, I would keep taking the antibiotics, and I wouldn't do anything else. And the only thing they could possibly done, this doesn't need to be opened up or anything. I could put a needle in there, but I don't think it'd be a big benefit. One thing.
What should she look for? Just before she calls or comes back,
Well, I guess
when to know it's not good. If it gets huge.
ever increasing pain or nasty drainage out of here or redness. It's a little bit more difficult to tell redness on your skin because your skin is dark, but it's still increasing redness, increasing swelling. And I mean, it is a little more swollen than it was.
But a little swelling's nothing to worry about. I mean, if it gets this big, she needs to call you.
Right. A little bit of swelling is nothing to worry about. I think that probably is small fluid collection there. Sorry. I'm not going to mash that anymore. And if it feels good, you could try to put a heating pad on that, but if it doesn't, don't.
Yes, sir.
And I would finish the antibiotics, and you're doing your facial exercises for me.
Yes.
Okay. Look at that. Now, so you were definitely able to lift that mouth up there. Yeah.
It's way better.
Yeah. Keep working on that. Okay.
And then with that final pathology report, you remember?
The final pathology showed. I had said because they were concerned that it was a cancer before, and they said it was the actinic cell carcinoma. And so I think he called one of my nurses and said, "Well, how often do I need to see you?" Well, I'd like to see you at intervals only for 5 years. That doesn't mean every month or every week. It's more like every 6 months. But so it's a parotid cancer, but not a highly aggressive one. So I don't think you need radiation therapy or anything like that. But I mean, it could come back. Cancers can, and benign tumors can. But cancers can, and if it did, you may need more surgery, but I don't expect that. And that little swelling there, that's not like a tumor coming back or anything.
Oh, okay.
No, that's not. It's too early for that. Okay?
That's what I was going to ask you.
Yeah.
Did you think I need radiation?
No, I do not. I do not. Keep doing your exercises. Heating pad on here if it feels good to you, but not if it doesn't.
Okay.
Finish that antibiotic, and you're coming back to see me in a couple weeks. But I'm glad your face definitely looks a little better. So, and it's going to get back. It's going to be back to normal.
Okay.
And
Is
so,
this a common form of cancer that you see a lot?
no, it's an uncommon form that I have seen before. In fact, I operated on a doctor about 9 months ago that had it. No, it's an uncommon form, but it is a form.
Gotcha.
And 80% of all tumors in the parotid are benign, and 20% are cancers. And this is one of the more common. I think mucoepidermal, it's just a type, is the most common. And actinic cell is a less common type. And then there's this one called adenoid cystic. But so no, it's not common, but I've seen it before a couple times. Mostly we see benign tumors in the parotid, and we don't know what causes any of them.
Okay.
But no, actinic cell generally does not require radiation. Okay? And I don't think yours does.
Okay. And so, like when you got the tumor out, the surrounding tissue didn't have it in there?
No. I mean, it's I got all of them. They didn't see anything that, no.
Okay.
Yeah.
So there's nothing to worry about. She comes to
Yeah,
you
nothing to
for
worry
6
about.
months and don't think about it till
I don't
then.
want you to worry about it. Let me worry about it.
Yes, sir.
Okay?
Yes, sir.
And keep doing your facial exercises.
Okay.
And come to see me. I think maybe it was in Smyrna.
Yes.
Okay.
On
All
the
right.
27th.
Right. All right. Hang in there. Take care.
Thank
Just a minute.
you.
I'm going to have my nurse check you out. Good to see you.
All right. Thank you.